Hey everyone, welcome to this episode of the Powered by Iron Health podcast, where we are creating communities that raise the standard of health and wellness. That's our vision at Iron Health. Today we've got a special guest, Dr. Ryan Dalton. You go by doctor?
If you call me doctor, I'll go by doctor.
Nice.
Yeah.
Dr.
Nice to be here.
Dr. RD, as we call him. He runs our Peekskill office, Peekskill, New York, and he's been with us. How long have you been with us?
Since last February. So,
wow. Not even a year though.
No, started in February of the year before,
okay.
but yeah, came on like full time in September or October, something like that.
Nice. Well,
Yeah.
we're glad to have you.
Yeah, it's good to be here.
Yeah. I always like to start a story of like how you became a PT. I think it's always interesting for people to hear that. And if there's any listeners who are interested, the different paths of how people actually choose to become a PT.
I think that my path is probably pretty typical with most people that get into PT, especially outpatient. So I grew up playing sports, played 3 in high school, and naturally you get hurt every once in a while. I never had anything, no major injuries, never had a surgery, knock on wood. But on 2 occasions, I went through PT, once in middle school, once in high school, and I really liked my PT. I enjoyed going. It was it was just fun. It was mentally stimulating, and it was an environment that I felt comfortable in. It didn't feel like it was going to the doctor's office or something like that. And then I also felt like it helped me both times, whether it was get back as good as I wanted to be or faster than I wanted to be. And that PT that I worked with, I ended up shadowing later on. She helped give me some of those observation hours. Went through college, played basketball in college, had some injuries there, had some more experiences with PT, again, were positive. And it just seemed to align with what I did well in school with. And I like being around people. I wanted to stay connected to health and wellness and athletics, which is why I'm in outpatient, because I like to stay connected to that population. And thought it was like pretty natural progression.
Yeah. What did you major in college?
So I started off as a bio major because I had an idea that I wanted to do PT or at the very least something in healthcare. And I remember talking with my advisor freshman year because my school didn't have physical therapy. I went to St. John Fisher College in Rochester. And we looked at PT schools, we looked at what all of their prerequisites were, and it's like, okay, you need a year of bio, anatomy and physiology, a year of chemistry, a year of physics. Like, you cover all that with a bio degree, just do bio. Then I also saw that there were a bunch of psychology classes that were part of prerequisites for PT school. So I went with a psych minor. I don't know where along the lines I changed to a double major in psych and biology. And came time that it was my senior year, so I'd been double majoring the whole time. And I was trying to get out of school with as little debt as possible, so I brought credits in. I was trying to get out early. My, work study job was in the compliance office of the athletic department. And it was the end of the summer going into my senior year. And my job was to read all of the legislation that came out and how it affected student athletes that year from a compliance perspective. And one of the new rules my senior year of college was if you played a winter sport, because it covers fall and spring semester, if you played a winter sport and you graduate in less than 8 semesters, so 7 or less, you are allowed to finish playing. So I was like, all right, I'm done with my psych degree. I had basically a full year worth of science classes, none of which were prerequisites for PT school. So I dropped from bio major to a minor and cut down to like 3 classes in the fall, psych classes, and graduated right there.
Really?
Yep. So I only did 6 full-time semesters in college, 1 part-time, and didn't pay tuition for my 8th semester, but was able to finish playing basketball. I'd already been accepted into PT school. I'm like,
that's crazy.
What do I need to do?
So what's your degree? Your degree is in biology?
My degree's in psychology and a minor in biology. Cool. I started the opposite and switched because, if I'm being honest, the psych classes were easier.
Yeah.
the science classes, I took all of my prereqs early on, and then at the end, I was just kind of filling them in.
That's interesting.
Mm-hmm.
So you got a whole year.
I'm probably, I don't know, I'm like plant bio and organic chemistry away from a bio major.
Well, you need plant bio to be a PT. you can't have not know about plants and not be a PT.
Yeah.
It's, you know,
was it
makes
plant
sense.
or was it micro? I was one of those two that I didn't take. I can't remember which one I did.
It's a similar story to me. Like when I was in college, I went to my school thinking, did I tell you the story?
I don't know. I don't think so.
I went to my college thinking it was a joint degree. So I had 3 and 3.
Mm-hmm.
So I was taking summer classes, bio major as well. I took like physics in the summer and some other summer classes. And I was like, I'm just going to graduate early and then go to my PT school in 3 years because I needed X amount of credits. Went to the PT school and I was like, yeah, I'm in the joint degree. You know, my school has that. They're like, no, we don't. I'm like, well, really? It's like, yeah, you don't have that. I was like, shit. So my whole senior year, I had 1 class, 2 classes. It's like a joke.
Yeah.
Just, you know, that was my gap year, right?
Yeah. That's basically what I did. I got a job as a teacher aide in a local school basically for money. But it was nice. It was 8 a.m. to 2 something p.m. And I get out, go to practice. I had money for the weekends. It was good.
Yeah, it's living a dream right there.
That was a great year. Yeah.
Where'd you go to PT school then?
SUNY Upstate Medical University in Syracuse.
Okay. And they have a whole medical.
Yeah, they have a med program. They have physician assistant. They have nursing. They have like your X-ray, radiology, MRI tech, everything healthcare. Yeah, everything. Yep.
I think I had a buddy who went there.
I thought it was the best. It was the most cost-effective place to go. I only applied to 3 schools, but they've since changed it. They were the only school I knew that didn't charge a 3rd semester's worth of tuition. So you know how, I don't know if you paid fall, summer, spring. They bundled the summer in with the fall tuition payment. So we only had 2.
Okay.
And it saved a lot from going to any other school I looked at where they would charge you the set price 3 times the year. And they charged it twice.
Wow. I wasn't even aware of what my school was charging me. It was just loans. And
I didn't either. I got lucky. And then I remember getting the notice when we were graduating that next year they were basically going in line with all the other PT schools and charging a separate semester.
Crazy. You guys are doctoral degrees too.
Yep.
Are all schools doctoral degrees now?
I think so.
You almost have to be.
So.
Right?
I remember when I was looking, for some reason I thought Columbia was still a master's program, but not anymore.
No. Columbia is like pretty well-known PT school, program.
Maybe it was them or it was another school. I was surprised that they hadn't gone to a doctorate, but I'm pretty sure everywhere is now. What's coming up now is that some schools, it's a school out of Tennessee, but they're doing like an accelerated 2-year program. I know Baylor is also doing an accelerated 2-year where it's just you're straight through. Some are doing like a hybrid learning model where you can do a lot online and then you go for like a week or 2 at a time, intensive manual. But what's Jeff Moore from the ICE courses? He's a faculty member I think the College of the South or South College, where it's a 2-year accelerated program.
So how does that change? Like, how does that?
It's still a doctorate.
Yeah.
There's just no real time off in between classes. A lot of it is online module-based learning and calling in for like, I guess, Zoom or Google Meet or something like that for your lectures. And then there are set times throughout the year where you have to go and be on site for, the manual instruction.
Yeah.
And then the 3rd year, I believe, is like a kind of you've graduated. It's like a paid internship though.
So that's where you get your nice.
Yeah.
That sounds nice to me. Do you think
I would have done that?
Yeah, I would have done that too. It's like 100%. It's feasible. I think the way it is now is, and this is really going to go into the meat of this podcast, talking about PT as a whole. And it's crazy that we went to this 3-year post-grad program with so much more debt, but insurance companies' payments are decreasing and PTs don't make as much money as you think they would.
Right.
So, what are your thoughts on that?
My thoughts are that 3 years is a long time to go to school. And I thought I thought my school did a great job preparing us to go out and be new grads and to work with patients and to work with people. However, I feel like I learned just as much, if not more, in my first year working as I did prior to coming out.
Mm-hmm.
And that's not a knock on the schooling. It's just that there's so much that you don't know until you actually, are out in the field.
Yeah.
So I can see myself being that. You're probably the same way, being successful, self-teaching, reading on your own, having the accountability to turn on your computer and to watch a live class or a recorded class. Like I could do that and I could learn it. And so much of the stuff that we did was like that. You'd pick up on the manual stuff later on. I know from like an exercise standpoint, that was all taught outside of school. Like they didn't cover exercise really at all. What they told us was that's what your clinicals are for.
Yeah. Same with us.
You learned it after, if you didn't have an exercise background in the first place.
Yeah. It's an interesting conceptually, because I know like even PT school, just like medical school, right? Like they're prepping you to be a generalist. So you have peds and neuro, and you want to see what you want to like. But some of the things were like they force you to do it in acute care, and it's like for me, I knew I'm not going to acute care. Like why do I even have to do this? Like you said, I don't want to talk bad about education, but it seems like a lot of it was fluff. In reality, honestly,
it was a lot of it was checking boxes.
Yeah,
that's a lot of things.
The model you're talking about with the 2 years is probably a little more realistic.
I think so.
Saves money too, right?
It saves money, and then you essentially get paid for your clinical rotations because they push it all to the back. I'm sure it's like a really reduced rate, but I mean, we did, is it 40 weeks? I don't know, 36, 40 weeks worth of clinical rotations throughout the 3 years. Is that what you guys did? I don't remember. I don't remember. 2 10 weeks, 2 8 weeks, and then like some part-time ones mixed in. And I know that to be accredited, you need a certain number of hours or weeks in the field. But if that's pushed to the end, even if you're getting paid, below an entry-level salary rate, like that's still a better deal than paying tuition to go and be a student for somebody.
Yeah, that's an interesting concept, because they're pretty much 40 weeks is 10 weeks away from a year anyways.
There you go.
Right? Yeah, that's wild.
It's a big difference. It's not just that you're not making it, you're paying tuition at an interest rate for it.
I wonder where the resistance is for that, though. Like, why wouldn't all schools want that?
Why wouldn't they want? Because they get an extra tuition payment while the kids aren't on campus?
What do you mean? They're super nice.
I don't know. I think it all comes down to that.
When you were going to PT school, did you have any idea about student loans and like the concepts of student loans?
Yeah,
okay, so that helped you a lot.
I remember going to school and in the interview, you get out of the interview and the first thing we did was, and this was at a couple places, it's like, okay, go into this room, and we almost got pitched on new student housing that was being built. And it was nice. It was really nice buildings. And I had friends in the area, so I'd already had plans to live off campus and pay for an apartment that way. And I was lucky in that sense that I had people to fall back on and, who knew the ins and outs of where to live and what the going rate is. But I remember it being 2 or 3 times, my rent payment would have been 2 or 3 times higher had I been on student housing. And in the student loan package you got, it covered it.
Wow.
So I knew a lot of people that just took that out in loans and paid probably still paying the 6% interest.
They probably didn't even realize.
it.
Because they don't tell you. I know, when I went, I had really no concept. Yeah, you're right. That's crazy. I had no concept of loans like that when I was going to PT school, because I just wasn't educated in it. Mm-hmm. I was like, oh, whatever, I got to get loans. It's just a part of it. You don't even realize that, like, when you're an adult, it will come back with vengeance. And federal loans that are 12% is absolutely insane. Mm-hmm. Let me have a whole podcast just on that.
Yeah,
they are like 12%.
Whew. Mine are in the 6s, I think. But still, anything like that's crazy. I know my total debt burden, about 20% of it is from 4 years of undergrad, or 3.5 years of undergrad, and 80% of it is from 3 years of grad school at a SUNY school. Yeah. And the undergrad is from a private school.
Crazy.
Mm-hmm. You would think it would be backwards. But
yeah, that would be. But that's good. You went SUNY though. You were smart with that process. What would you tell people who are trying to become PTs? Like, give them some advice. Give them three to five bullet points of what to do.
So I would say, one, limit your debt burden as much as possible. Like, talk to somebody when you're in high school about it. If you're I think there's a certain point of coming out with, and I don't know what that threshold is of debt, but once you pass a certain threshold of debt, any career might not be worth it. You have to see what you can make, and is it going to be worth it paying that off? Like, are you going to have the quality of life that you want? And I know more now than I did then, but I was thinking about that a little bit, and I'm glad I did, because it works for me. Knowing what some of my classmates came out with, I don't know if that would be worth it for me. It's really a personal decision, but you have to have an understanding of how much debt you're going to have and how much that's actually going to cost you every month once you graduate.
Yeah.
There are some papers on it. There's some papers that look at what the average debt level is for each healthcare practitioner, and what starting salaries are, what median salaries are, and it gives you like a graph of what is the most worth it.
Yeah.
And sometimes it's not what you think. PT was kind of right in the middle. It wasn't like the best. It wasn't the worst.
Do you remember what the best was?
I don't
and the
remember
worst?
what the best was. I want to say it was maybe like a physician assistant, or that was physician assistant and nurse practitioner were up there. Any nurse anesthesiologist was up there.
Yeah,
so anything where the years are down and the debt is down, but the earning potential is really high.
Yeah, I could see that. I wonder what the worst would be.
It's a good question. I don't remember. I can look it up. I have it on my computer.
I feel like PT would be on the lower end than anything else, medical wise.
Yeah.
You know, because what else do you have? You have PAs, PT.
It was a long
MDs.
list. It was. They even broke it down by like different medical doctors. So like
family doctor.
Yeah, family doctor. What is it? Orthopedic surgeon. Dermatologist. So like there are different ones that, obviously you can make a little bit more.
Yeah. That's wild. Mm-hmm. So for PT wise, what was your experience like, since we were going to dive into the state of PT and kind of our model?
So I wasn't when I was a student going into my last rotation, I was with a lot of the people in my class. I'm like, absolutely not doing outpatient ortho. It's like, I didn't have any bad experiences with outpatient, but a lot of my classmates did. And I just felt like you're at a mill. You're just churning one after another. And I actually didn't even have that experience, but it was kind of like ingrained in my head. And I had a really good experience at an acute care at a cardiopulmonary ICU for my third rotation. And it was in Syracuse. It was actually at the college. It was at the hospital of the university I went to. And I was thinking of doing that because I liked it. I also liked the hours. It was fast paced enough. It was like your adrenaline got going because everyone was coming out of a triple bypass. Like there were a lot of lines and tubes, and it was different. It was a little exciting. So I was thinking that. I went to my last rotation, and it was a place that had a model very similar to ours. It was an in-network facility, but we did not churn out people. And you'd see at most 14 people a day. You're never full completely. So in most days it was 10, 12 people a day. And I loved it. And my clinical instructor was very forward thinking, taught me a lot about exercise. I was excited to come to work every day. And I eventually signed on to work with them. And if I hadn't had that experience, no chance in the world I would have done outpatient, because I wouldn't have known what I was walking into.
So you didn't know at all what to expect in outpatient?
I already had one rotation.
Okay.
And I think there were 3 people an hour that I was seeing, or that the clinic saw. And I remember seeing the therapists, they were burned out. They were 100% burned out. And I just didn't want that.
Yeah.
I didn't want to work longer hours and be burnt out. Like you had to make the trade-off somewhere.
Yeah, that's a tough one, right? Like that, it's like if you're going to be burnt out, just like you might as well work in a hospital or a school.
Yeah.
What do you think burnout is in the PT world? Like, why do you think it happens?
I feel like it happens because it wasn't what you were expecting, and maybe it's not worth your time or how much effort you're putting into it. That's where I think it comes to, and it's almost like, damn, I wasn't expecting to have this type of like mental load, because you're talking with people all day. We're healers to a certain extent, and we're taking on that emotional burden too. So it's not just the physical aspect, it's the mental aspect. And then if the financials don't completely align with how much that is, I think that all contributes to it.
Yeah, I think that's a good way to put it. The false perception of what is really, because everyone gets into PT to help people, right? For the most part.
Absolutely.
You're not getting into it to make money. You're not getting into it to turn and burn people. But then they get these experiences and it's like doesn't align to what they believe PT is.
Yep.
So it's a sad thing that that's the norm, truthfully. But I'm glad that we have a niche where we don't have to do that, and we are a little bit of a dying breed, but it is a niche, right? So,
yeah.
What do you say to those people who are in those turn and burn places, and like how would you deflect the burnout?
I think that it's the longer you're at a place, the harder it is to you get comfortable and you get complacent, and it's like you'd rather stick with what you know than to go out into the unknown a little bit. And there aren't many places like this. I mean, I don't know of any other place like this actually that employs people. There's probably some like individual practitioners that do one-on-one, maybe all private pay, but that's what attracted me to Iron Health. When I saw the job listing, I left the job that I was only at very briefly, and I was open to everything, not just outpatient, but I wouldn't have applied to an outpatient facility or business if it didn't say that 40 minutes of one-on-one time.
Yeah.
That was the only reason why I applied, is because it's like, if I'm going to do it, I want to do it right. I don't want my head to be on a patient here, there, and there at the same time ever again. That was just the deciding factor for me. So you have to look for it. If I couldn't find it and I was at a place that was doing 4 people an hour, I would probably move to a different, what's it called? Acute care or home care or something like that, where it's a totally different dynamic, but, and you don't get, like, this is the setting I want to be in. I'd have to sacrifice that to not have 4 people at a time. I just wouldn't do it ever again. How
do we shift it as a whole? Like, how do we shift the perception of what PT is too? Because I feel like a lot of people, when you say PT, just think about hot packs and stim. Like, how do you shift the industry? Because that's what we have to do.
It's really hard. I was surprised when I got here at how many people how nobody asked for heat or stim or ultrasounds or, any of the passive modalities that were driving me crazy in the past. And I mean, it's almost like like-minded people refer like-minded people. Yeah. And the people that are coming to Iron Health, they know what to expect because their friend or their family member told them. It's like, oh, I went to PT and this is what I did. How do you shift it? I think that the current outpatient business is incentivized to use them as much as possible, because any way that you can get more patients in the door at the same time, they get reimbursed for it. So if that means you can put a hot pack on someone and a cold pack and stim and leave them and see someone else, as long as that's insurance companies reimburse for that, even if it's not technically for the hot pack, it's not going to change, because it's a time saver. It allows the therapist to put the patient over here and go see someone else.
Yeah.
And make it work. And
cookie cutter.
Yeah. Cookie cutter, and it's like a factory.
It's definitely a factory, and they're all in, they all know each other. They're all within each other. What are their hurdles of, well, let's say what are the hurdles of this model as well, because there are some, obviously. And then let's talk like new grad PT in this model, because I think that's an important thing for people, if there are new grads, to understand this concept and what it takes to be in a model like this.
The first thing that I noticed coming here was 40 minutes one-on-one with a patient is a long time. And you can get everything done that you need to with them. And I've said this since I started working, that the most powerful thing that we do is educate patients. And we have all the time in the world for that. It was actually hard to fill the whole time before, because I was so used to getting done what I needed to do and then telling them, all right, this is what you're going to finish up with. I'm going to go start with my next patient. So can you just rephrase the question again?
So the hurdles of working in a model like this was number one. And then number two was
the hurdles,
being a new grad, and how do you get to work in a model like this? And how can they, what to expect when if they do work in a model like this?
So a hurdle here, and it's along those lines of what I was saying. You can't hide. I think that in other models where it's just like, all right, you just have a person in front of you for 10 minutes. It's a lot easier to do something in those 10 minutes, but it's a lot harder to do something valuable for 40 minutes consecutive. It really is. And especially when you have people who are with you for a long time too. You have to be, there's more room to be dynamic, but it's a blessing and a curse. You have to do something. You have to use your time wisely. So the cookie cutter approach isn't going to work with this, because people are going to sniff it out. They're here for a reason. They're here to get value for their time, and they're actively choosing this over the other model. And I think that's the biggest hurdle, is we have to show that we are adding that much more value than the alternative.
It's all value add for sure.
It's going to cost more, whether it's out of network or whether insurance doesn't cover it. I think I would tell my family members to go to a place like this over the alternative, because I know if they actually have an issue that needs to be worked on, there's a lot better chance of it getting resolved here than the other place.
So true.
And that has nothing to do with the quality of the clinician that works at a place that's seeing 4 people an hour. It's just a matter of they don't have the capacity to help. They don't have the resources because they don't have the time.
Yeah.
It's the most valuable resource.
Yeah. You have to cut it down to be the basics. What are you going to do with that many people?
Nope. You can't progress exercises. You can't modify anything. Like, if you're going to naturally be safer is probably not the best word, conservative in how much you challenge somebody. Because if you're not there next to them and you're truly trying to do progressive overload, make them actually stronger, you need to push the limit a little bit sometimes. And if we're there, we know how to modify an exercise if it hurts. We know how to modify an exercise if it's potentially unsafe. But if I'm not next to that person, I'm not going to take that chance.
Yeah.
And most people won't. So you live in like a comfort zone as a PT, and you just end up doing the exact same thing every single day.
It's like a loop.
It's a loop. You're on a hamster wheel.
So do you think progressive overloading and this is like more tactical, like progressive overloading for most injuries is necessary?
Yeah, I do. Yeah, absolutely.
What do you say to the people who say you shouldn't squat, it's bad for your knees?
Oh my God. I think squatting is the most functional thing that we do.
Yeah.
What I'll go to is we sit and stand from a chair probably more often than any other movement that we do in our life. And that's the squat pattern. And our knees are meant to flex and extend. And if you want to be able to bend down and pick something up when you're older, if you want your base to support you for a really long time, you might as well make it strong and resilient.
Yeah, that's fair. It's a good argument there.
Yeah.
So let's backtrack to the other question with new grads. And, maybe this could be a good episode for new grads or people thinking about PT. What do you say to them? Like, how do they get the ability to work in a place like this or a model like this? And what should they really be prepping when they get into a model like this?
I think as a new grad, and I think I did it. I think I did it in part because of the mentor I had, but I said yes to everything early on. If we needed extra hours, I took it. If we were doing a seminar at a local gym, I went to help out. Any continuing ed that was offered and the company's going to pay for it, do it. Take advantage of it. Like, you're still in that, not that we should ever get out of like a growing mindset mode or a growth mode, but you just finished school and like you're still in it. You're still like extremely hungry and you're used to putting in extra hours at night to study. So like, start studying for a specialist exam, your OCS, right away. Like, you can't take it for a year or two after you graduate, but you can still stay in the habit of studying. Basically dive in, say yes to everything, and work your butt off for the first couple of years, because that's what's going to give you, I think, the opportunities year 2, 3, 4, 5. I really do think that doing a lot of that work up front and not asking for much right away. Now that sounds bad, but do the work up front and it'll pay you off in the end.
Yeah.
I don't know if that answers your question, but that's the mindset I had.
I think that's a good mindset lesson there, you know, like for anyone. What's interesting though is like PT school is it's not fucking easy, right? So it's, you know, anyone who's going through it is already struggling to do something very hard. So you would hope that carries over to when they get their first job, but sometimes maybe it's because they think now they are a PT, they can coast. I don't know, but that's a good way to frame the mindset, to say like, hey, this is what you have to focus on.
I was lucky. My mentor, when I went in, was starting to study for his OCS, like right when I was starting. And I think you can, submit your application to take your OCS after you have approximately 1 year of working hours. Like, it's like 2,000 hours or something like that. 2,000
hours, yeah.
Okay. So what we did during our weekly meetings is we just picked a different study topic for the OCS, and I did it with him as he was studying for it. So I had 1 full year of studying for it. Then I was able to submit my application to take it again. And I didn't have to study as much that second year. It was like that natural, a natural mentorship that any new grad would have. You just go over different body parts, go over the clinical practice guidelines, the clinical prediction rules that I needed the refresher for anyway as a new grad. And anytime a new case came up, we would go to that section of the study guide, and it felt like it was just a normal progression to starting off in a career. But I just happened to have a good mentor that helped me through that.
Yeah.
If he hadn't done it, I wouldn't have done it on my own. I needed that like little push. He's like, all right, this is what we're going to do. Planned out like 6 months at a time. We just knocked it out.
What is the OCS for people who don't know what it is?
Orthopedic clinical specialist. There's, I don't know, 7, 8, 9 different specialty certifications you can get in PT. There's peds, neuro, sports, orthopedics, geriatrics. I know I'm missing a couple, but that's essentially what we do in outpatient. Is we see orthopedic cases, so anything bone, joint, muscle. You and I both have the certification, right?
Yes.
Yep.
What do you think about it? Do you think that, like, my personal belief, it's not as valued as much as it should be? Like, if we're gonna, like, it, you know, you should.
It's interesting. Yeah. I don't know. I go back and forth. I think it's more valuable earlier in your career than it is later in your career.
Because of education, or because later in your career you have so many more hands-on bodies?
Later in your career, your experience, I think, is going to outweigh it. I think it's important to stay up with research, but I can't imagine we're going to have this like tectonic shift in what the true nuts and bolts of PT are. I think there's always going to be different like ways we can educate people, but in the end, we still need to move well. We still need, our manual techniques are still going to be our bread and butter. Our exercise progressions are going to be the bread and butter. Maybe how we educate people changes a little bit, but I think our experience is going to outweigh our training as we get more reps and years under our belt. And early on, it is a way to demonstrate competence to patients, employers, physicians. In addition to showing that you're still like in the weeds, you're still
learning.
Still learning. Yep.
Yeah, it's well said. What do you think will change education-wise in the future? AI?
I love AI, but I don't know. I don't know how that would change. What do you mean change?
Well, you said like you don't see much changing for PT, like the nuts and bolts will still be there, but maybe educating them will change. So I'm just curious on like what you think about
science. So I know that that's a big shift in how we view pain, probably when you and I are going through school versus when someone who went through school 30 years ago. We now know our nervous system regulates so much in our body. And just because we have pain in our foot doesn't mean that there's necessarily tissue damage in our foot. It's viewing it as like an alarm system, as like driving you to either inaction or action, driving you to change something. And it's more of a response than something you're receiving from the environment. So I think that's just an example, I would think, of how we view pain and what its purpose is and how do we affect pain.
So you think pain, the way we look at pain is going to be completely different, or that's really where evolution is?
Yeah. Yep.
So what do you think about the people who talk about pain science and like manual, like that it's not really necessary?
I disagree with it. I think that it is a huge part of what we do. So like getting to the root of it, like a lot of things may have a placebo effect, but if it down-regulates our pain response, if it gives us more room to operate, more room to move, more room to challenge somebody, and with a lower pain signal, then I think it's worth it, because we know moving is beneficial. There's so many benefits to exercise, more than we can name in a 5-second little segment right here.
Yeah.
But we know people need to move, and I think manual techniques are an avenue to, even if it's temporarily decrease pain, not solve the root of the issue, it allows for that. And I think that anything that allows for more movement and getting stronger and becoming more resilient and increasing someone's self-efficacy and confidence in their ability to do something is valuable. And we know how to do that. We know how to grade our manual. It's not all the same. Like, you don't put the same pressure on patient A as you do patient B.
For sure.
Because maybe one person likes deep pressure, deep tissue massage, or more aggressive joint mobilizations, and the other experiences pain when you do it. So it's not cookie cutter. It can be.
Yeah.
So I think it has to be beneficial.
That's a good way to think about it, honestly. So do you think the profession is going to have more psychological courses? Like, do you think that's where it's going to morph into as well?
Yeah, I do. I think there's already places doing it. Like ICE, they had a pain science course, and in every course they give out, they talk about that early on. It is one of their 3 pillars is psychologically informed.
That's good.
I think we have to be.
If you have a crystal ball, you look 10, 15 years down the line, what is a PT doing?
What is a PT doing?
Defines physical therapist.
I do think that there's going to be more of a, there's going to be more of the same, where there's a lot of places that are churning out as many visits as they can. I think that there's going to be more of a presence online on the virtual technique, because of how I think how much benefit there is to educate people, that there is an avenue where you can do that over Google Meet or Zoom or some sort of video conference and get value out of it. But I think that there's still going to be a need for someone right in front of you where you give them time. As we go on, I imagine time spent with your healthcare provider is going to keep on dwindling, going down. And what we're doing is we're going the opposite direction. I think we're only going to be more valuable at that time.
Yeah.
I'm sure insurance is going to change a lot. I'm optimistic actually that some of it's going to change for the better, because if it keeps going this way, I think it can't keep getting worse, because it won't exist.
Yeah.
It won't be worth it for anybody.
That's a good point. It's a really good point.
It's going to hit a critical point. I don't know when that is.
What would be your guidance for someone who wants to be going into PT?
I would say get out and shadow and experience every different aspect of it that you can. It's going to be really hard to shadow someone in home care unless you know the person, and there's probably like a ton of hurdles to getting there. I know there were hurdles for me to get in and shadow people in a hospital, but get to outpatient, go to different places. One PT office is not the same as every other one. So you have to experience it and find a mentor, find someone who will let you shadow them, that will just be honest with you with the pros and cons of their job. I think there's pros and cons to everything. And the pros of our work environment far outweigh the cons, and that's why I'm here. And you need to just get as many pieces of advice from people as possible. And then back to what we talked about earlier, is making sure it makes sense financially with what you can make potentially and how much debt you're going to go into. Those things all have to align. Those would be the big two ones, is experience it and understand the financial part of it.
Yeah, I mean, those are stellar, man. If people want to shadow you, how do they get in touch with you?
In touch with me? Probably the best way is on Twitter, RD Dalton 21. I'm not active in terms of posting myself, but I'm on it every day.
Nice.
But yeah.
Very
Always
cool.
reading.
Yeah, Twitter's a good spot for that.
Mm-hmm.
Go always be learning.
Yep.
All right, guys. Thank you for watching this one. You're a great guest. This is fun. This is the state of PT here. I hope you guys learned a little bit. Share it, like it, follow him on Twitter. Check out Power by Iron Health.
All right. Thanks for having me.
Yeah.